If you're thinking about having plastic surgery, choosing the right doctor is one of the most important decisions you make. Dr. Peter Klainer of Chrysalis Plastic Surgery is here to talk about breast enhancement and correction and what you should think about before going under the knife. Good morning, Dr. Klainer.
Good morning, Angela. How are you?
I'm great. You know, one of the things I think you should be thinking about is making sure your doctor is a board-certified plastic surgeon.
Well,
right?
I have to agree with you, being that I'm board certified. I think it just gives patients the reassurance that you've been well trained and know what you're doing in the operating room.
Because oftentimes people go for plastic surgery and it might be a cosmetic surgeon, and it's definitely not the same thing.
No, being a board certified plastic surgeon means that we've gone through a regimented amount of training, taken 2 tests that we had to pass to get the title board certified. Where I do cosmetic surgery, but the difference between cosmetic and plastic surgery is I also do reconstructive surgery. I do hand surgery, facial reconstruction, breast reconstruction, whereas being a cosmetic surgeon alone, they only do cosmetic surgery.
You're doing it all.
I try.
So, you know, these days, who is coming in to see you? People who want breast rejuvenation. Who's your I guess, the most common customer right now? Patient?
Well, I guess being in Virginia and not in Los Angeles or Miami, the most common person I see for any type of breast surgery ranges between 25 and 45. They're often post-pregnancy, where they want to get back the form they had prior to having children. Children, beautiful thing, but it's not all, women don't always recover, or their bodies don't always recover as quickly as we do.
Right, right. So people who come in and say, all right, I want to get back to where I was. What are some of the things that you recommend that they do?
Well, I put them in 3 categories. There are the women that maintain their size, but they quote-unquote droop. They lost some of the support after pregnancy. And those women sometimes do very well from just a small breast lift. There are the women who get smaller after pregnancy, and lose their volume, and they do very well with the breast enhancement. And then there are the combinations. There are a lot of women who not only lose their volume, but their skin has been stretched and drooped. And so by returning the volume to their breast and doing what I call a minimal scar lift, they can get back to the shape and the perkiness that they were before they had children.
Perky is good.
Perky's good.
Perky is definitely a good thing. Now, okay, there are a lot of misconceptions out there. I mean, and personally, I have no idea what goes into, I guess, a lift. And I would think there might be a lot of scarring after someone goes in for something like that.
Well, there are lifts that have a lot of scarring, and that's why I try my best to do what I can call a minimal scar lift, which basically is just a small scar right around, it comes out to be a circle right around the areola. And that's the only thing you'll see, and it happens to be one of the best healing places in the human body. So once it's healed, it's almost invisible. And if you can do that with a small implant, you often get a very nice rejuvenated look to the breast.
And that would lift as well?
That would lift as well.
Okay. And so if someone's coming in and they just want to be larger, maybe they didn't have children and they just say, okay, I've just always wanted to do this, and they're coming to you. What happens? They walk in your office.
Well, the first thing I try to do is make them relax and make them understand that breast augmentation doesn't have to be for more than them feeling good about themselves. A lot of women I hear, they don't like the way their clothes fit. They don't want to wear the padded bathing suit anymore. They just want to feel good about themselves, and getting a little bit more volume, not necessarily very big, but just a little bit more volume is all they really need to make themselves feel better.
So, all right, another thing is someone would say, all right, I've always wanted to do this, but I didn't win the lottery. I can't I can't just go to a plastic surgeon and get the size breast that I want. Are there payment plans or any kind of options?
Well, the first thing is that breast surgery doesn't have to be super expensive. I mean, I guess if you go to New York or if you go to Los Angeles, the prices can get very high. But what I believe is I'm here to try to help people, whether it be through reconstruction or cosmetic surgery. So I try to keep it as reasonable as it's able to be. And there are options. You know, there are things, cash, credit cards, but we also do work with a company called Care Credit, and it is a cosmetic financing company which tries to make the payment plans very reasonable for patients desiring cosmetic and reconstructive surgery.
Dr. Klainer, you hear in the news all the time about plastic surgery gone bad. Do you find yourself, I guess, correcting a lot of mistakes from other surgeons?
I never want to badmouth any of my colleagues because I do surgery, and unfortunately I have seen some bad cosmetic surgery by non-plastic surgeons. And the fact is, yes, I do some corrections, and not always corrections from bad surgery, but corrections can also be from, for example, women who've had implants that have, over the years, deflated. That is a correction, and we have to go in and we can simply exchange the implants with minimal downtime, minimal scar, very simple procedure, and get them back to where they were. Or corrections where they've had a procedure and gotten pregnant after the procedure and have to do some revisions or corrections to get them back to where they were, again, prior to their pregnancy.
Okay. Dr. Klainer, thank you so much. You cleared up a lot of questions, and certainly sounds like you're the one to go to if someone is looking for.
Well, you're very kind, and I appreciate
surgery.
you allowing me to come on today and speak about something I'm very passionate about.
It's been a pleasure.
Well, have a great day.
We'll have more Let's Talk Live coming up right after this.